Hello everyone, welcome to National Focus. I'm your presenter Tarnia Green. It's always a pleasure to have you join us. Topping our headlines, Chinese business community come to the assistance of the Campbell Primary School. Over 500 graduate from New Skills from Adult Education course, and a two-day workshop to improve on the care administered to patients with chronic non-communicable diseases. Stay with me as I bring you the details of these and other stories when National Focus returns. Welcome back. Time now for the details of the news. Environment Minister Honorable Dr. Kenneth Darrow is back on island after participating in a seminar on environmental education and sustainable development in Georgia. The minister told GIS News that participants at the Tbilisi Plus 35 conference were encouraged to get all involved in the protection of the environment.
In order for us to push our agenda of environmental protection and sustainable development, the public and everybody has to be educated on this. Take for example all the work that we've done in environment here in Dominica, and also the formation of a green economy. But for it to succeed, it has to be something that the entire public, the entire population has to be seized by this, starting from school, the private sector, the public sector, NGOs, each and every member of society, because we have to admit that each and everybody has to play their part in protecting our environment and ensuring that our natural resources that we are using here today, that they are used in a sustainable way for the use of future generations.
The participants agreed that a number of measures should be adopted by respective governments to promote education of the environment and sustainable development at all levels of the education system, including early childhood centers.
It's never too early to tell the preschoolers that, hey, you should not pollute your rivers, okay, that you should try your best to use recycled materials, that is to ensure that, as I said, that from a very early age, that they are seized with the idea that if we don't take steps today to protect our environment and also to use our resources sustainably, that there will be nothing left for the future generations.
A multilateral fund is expected to be established to enable all the policies and recommendations from the conference to be implemented in the respective countries. The government of Dominica has played a leading role in the area of environment protection and sustainable development.
Our climate resilient low carbon strategy is probably the first of its kind in the Caribbean. We've seen the amount of money that we have invested in renewable energy, namely geothermal. So we are literally putting our money where our mouth is, where our money is, sorry, and we are seeing the results of the innovation and initiative of the Honorable Prime Minister when he created this ministry for the better part 3 years ago. Because he realized the importance that this whole environmental and sustainable development issues are taken at an international level. And of course, we are already starting to see the rewards of our hard work. We know that our climate resilience strategy, we've already had visits from the World Bank, where they've come in to identify, they've already pledged some 40 or 50 million EC dollars toward priority projects. I'm sure you would know about the 7 priority areas that were mentioned in this climate resilience strategy. So all in all, we think that in the area of environment and sustainable development that we are doing very well.
In more news, a two-day workshop on collaborative initiatives for chronic care improvements commenced Wednesday at the Crazy Coconuts. This workshop is the first in installments of the Chronic Care Project, which was created last year by the Ministry of Health. Helen Royer, Permanent Secretary in the Ministry of Health, says CNCDs are becoming more popular in the Caribbean region.
The Caribbean has the highest prevalence of chronic non-communicable diseases in the region of the Americas, causing much premature loss of life, loss of productivity, and spiraling healthcare costs. In Barbados, the prevalence rate and mortality rate of diabetes-related lower extremity amputations are among the highest recorded in the world. And that was according to a survey by Sir George Arding and in a report on the silent challenge of chronic non-communicable diseases.
She says Dominica is steadily following the same pattern as Barbados.
Dominica also follows the same pattern with CNCD being the main causes of both morbidity and mortality. For the first time in 2011, diabetes was rated as the third leading cause of death in Dominica.
As a result of diabetes becoming a common illness amongst Dominica's population, the Ministry of Health has sought to address the issue by creating ways to alert citizens on how best to prevent and protect themselves.
This dilemma, therefore, will require a collaborative initiative, whole of country and whole of society approach. CNCD has been afforded this type of priority attention by heads of state. The Chronic Illness Care Project is fully endorsed by the Ministry of Health as an effective strategy for obtaining our strategic objectives enshrined in the National Strategic Plan for Health 2010 to 2019.
Anthelia James, Coordinator of Health Promotions, presented a synopsis of chronic non-communicable diseases.
CNCDs, or chronic non-communicable diseases, the World Health Organization defines CNCDs as cardiovascular diseases, diabetes, and chronic respiratory diseases. And the risk factors, which are the conditions which lead to development of these diseases, are defined by the World Health Organization as tobacco use, physical inactivity, unhealthy diets, harmful use of alcohol. And in CARICOM, in the Caribbean, we like to have our own definitions specific to our population. We have agreed that CNCDs include heart disease, stroke, we have added stroke, diabetes, hypertension, obesity, and cancer.
Dr. Martin Christmas, Director of Primary Healthcare Services, says efforts are being made to fight the issue of CNCDs.
The problem seems to be getting worse, and something interesting happened in 2007. The CARICOM heads in particular realized the problem that our nations were facing in terms of morbidity and mortality due to CNCDs, and the commitment was made to actually fight those chronic non-communicable diseases. So we had other persons joining that fight, which was something that our doctors and nurses have been struggling with for ages, but the effort was now very well concerted. By 2007, the chronic care model, as it was actually accepted by the Pan American Health Organization. I think it was piloted in Mexico with a program called the VIDA program, and later on we had several Caribbean champions, persons like Professor Trevor Hassel, Alafia Samuels, just to name a few, that have really worked very hard in the fight against chronic non-communicable diseases. But here in Dominica, we've had some very silent foot soldiers who have been doing a tremendous job in attempting to control the CNCD problem.
Dr. Tomo Kanda, advisor on CNCDs for PAHO, shared some reality on the truth about CNCDs in the Caribbean region.
Chronic non-communicable diseases, which WHO we categorize 4 major diseases: cardiovascular disease, cancer, diabetes, and chronic respiratory diseases. They are the highest burden of disease in the Caribbean, and especially Eastern Caribbeans are highest in terms of mortality and morbidity. If you look at the reality, chronic non-communicable disease is the highest health priority, but in terms of quality of care, which health sector can provide for the nation, based on PAHO survey, unfortunately, the Caribbean regions are the less served country in the whole world. You must realize this. As you are a health professional, you are working every day very hard. You believe this is the first class, better health service for the patient. But if you look at worldwide healthcare services and quality. Unfortunately, there are lots of space we can still improve.
This training workshop was supported by the Pan American Health Organization.
This past 2 years, PAHO, which called Caribbean Project on Improving Quality of Care for Patients with Chronic Disease and their Family. Last 2 years, we supported Anguilla, Antigua, St. Lucia, Barbados, and Grenada, plus Trinidad Tobago, Jamaica, Suriname. And this year, Dominica joined, St. Kitts Nevis joined, and also St. Vincent and the Grenadines, and the Belize, and also Bahama joined. Almost 90% of Caribbean region joined this project.
Dr. Kanda explained what should come out of this two-day workshop.
Most of the island you have conducted which called Public Health Essential Survey, which Dr. Christmas was in charge. The PAHO did a very comprehensive survey on primary health care, what is the human resources, what is a missing opportunity, and the budget. We did a very comprehensive survey. You know what is a strength, you know what is a weakness. But if you don't make any action based on the survey or data collected, there's just for data collection for data, right? These 2 days, I really want to talk to you and discuss with you, first of all, what is the situation, real situation in Dominica? And I want to know very frank, honest opinion from you. What is the challenges? What is the missing opportunities? How we can improve?
The two-day workshop ends on Thursday. The local Chinese community continues to take its social responsibility to the Dominican community seriously. On Wednesday, a group of Chinese business people made a donation totaling $27,000 towards the implementation of an early childhood education program at the Campbell Primary School. Mary Wang, in speaking on behalf of the Chinese business community, said the donation is one way of saying thank you to the Dominican public for their support. Ms. Wang is hoping that this donation will be to the benefit of the development of the children in Dominica.
After making a donation to Goodwill Primary School last year, we decided to help Campbell Primary School with its repair work to the best of our ability. We hope this could enable the students here to have a better environment to study and to have a better basis for further development.
The donation is in keeping with the Ministry of Education's policy of ensuring that every child has an opportunity at receiving quality education.
As a ministry, school improvement is very important to us, and it is at the center towards the drive to provide high-quality education for all. For this academic year, our new vision at the Ministry of Education is every child succeeds. And this contribution will help us to do just that.
Parliamentary representative for the Maho constituency, Honorable Rayburn Blackmore, expressed thanks on behalf of the government and the constituents of Campbell.
Certainly what is taking place here today is bringing out the brightest vision in the Campbell community and also the business community. And it is so nice to have persons who have invested in Dominica, who, of course, run a business for making a profit, but recognizing, of course, the support that they get from the respective communities, that they have to demonstrate some form of social responsibility. And what better way so to do by embracing a rural community and investing in you, the young people of Campbell. I want us to put our hands together for the Chinese business community.
Principals, staff and students of the Campbell Primary School are appreciative of the gift.
It is this and other much needed assistance which is most welcome and appreciated by us in this school community as we work arduously to ensure that the call for every child must learn become a reality here at our school.
The Ministry of Education has engaged a contractor to refurbish a room to facilitate the early childhood education program at that school. In more news, Chief Welfare Officer Martin Anthony, speaking at a recent crime and violence and anti-social panel discussion in Soufrière, announced new plans to deal with juvenile offenders. Anthony told the meeting that the Social Welfare Division requires the assistance of all citizens to properly tackle the problem of juvenile offenders. The welfare officer discussed plans to involve the community in the effort.
We have started a pilot project with about 3 villages where we have gone in, brought together community leaders, listened to what they're saying as what they think could be done, and we have started a process where we think that we can better educate not only parents but other sectors of the wider society. It is a collaborative effort, it is a partnership which we think will result in addressing certain issues with the assistance of members of the society.
Mr. Anthony underscored the importance of striking a balance between justice and welfare when dealing with juvenile offenders. He announced the impending commencement of a consultation expected to address just that.
A consultancy is about to start to look at in a comprehensive way how do you address matters pertaining to juvenile, starting from the pre-trial stage to the actual court setting stage and to the area of rehabilitation. What needs to be done in terms of rehabilitation? What needs to be done in terms of prevention? What needs to be done in terms of diversion? So all those issues are issues that we hope the consultancy will address in the area of those young offenders, particularly juvenile offenders.
525 adults graduated on Wednesday from various adult education classes, some achieving CXC success and others new skills. The graduation ceremony was held at the Arawak House of Culture and was filled to capacity with the hundreds of persons who benefited from the programs, government officials, adult education division staff and well-wishers. The theme of the ceremony was Create Your Family Dynasty Through Adult Education. Minister for Social Services and Community Development, Honorable Gloria Shillingford, told the gathering that she is proud of the success of the Adult Education Division and even more so of the graduates.
So let me congratulate the 525 persons who will receive certificates of participation and completion in the various programs. For some of you, participation in the program was difficult and might have called for some degree of sacrifice on your part. But you persevered, and here you are today. You have succeeded and are a part of this happy gathering of persons. So this ceremony is thus a token of recognition of your efforts, but it is a proud moment for you.
Honorable Norris Prevost, Parliamentary Representative for the Roseau Central constituency, was also present and commended the graduates for taking the initiative to learn something new, whether academic or technical. Melanie Francois of the Adult Education Division gave an overview of the program.
Today, 525 participants or learners, 75% of which are females, will be gracing the floors of the Arawak House of Culture, some of them for the first time. During summer 2012, various courses were presented island-wide, the result of which was clearly visible at our annual exhibition mounted beneath the ministry September 5th. Work concentrated in the area of basic and advanced sewing, smoking, doll making, pastry making, West Indian cooking, just to mention a few. What this shows is, if given the right tools and motivation, adult education can empower and bring about attitude change in the whole development thrust of Dominicans. The thirst for new knowledge is slowly but surely taking roots, and we need to pamper those buds. Over the years, adult education has been stigmatized as the area of education set aside for poor, foolish, and illiterate persons. However, division staff has been working tirelessly to change that perspective. Thus, our theme, which states, Create Your Family Dynasty Through Adult Education.
Francois also reported on the performance of the students.
English 80%, social studies 78%, accounts 50%, POB 85%, office procedure 100%, HSB 66%, French 100%, and the dreaded maths 23%. However, some persons still secured ones in maths. At the CCSLC level, that is, English 95%, social studies 95%, integrated science 88%, maths 65%, French 81%, and Spanish 75%.
One graduate who performed well at the CSEC examinations, Rick Blaise, had this to say about the program.
Just over 5 years ago, my mom wrote the junior secondary program exam with the adult education division and obtained grade 1s passes in all our core subjects. From her experience and example, I chose to do the same, and today I obtained 4 grade 1s in CXE level. Truly, we are a dynasty.
Also at the ceremony, members of the summer-long guitar class put on a show for guests. The aim of the Adult Education Division is to improve the literacy skills of the adult population, to promote activities aimed at lifelong learning for self-reliance and improve prospects for employment in basic skills. And that's the English segment of the news. We now join Macpherson St. Louis for the Creole highlights.
Alors tout le monde, bienvenue à ces nouvelles en créole. Non, moi, c'est Macpherson St. Louis. Premièrement, ministre environ Honorable Dr. Kenneth Darrow, te chef délégation Dominique qui te attendait séminaire en Georgia, qui concerne le développement sustainable. Participants en séminaire là tapé encouragement, manière pour protéger l'environnement.
35 ans passé, ces pays latins, ils assemblé à Georgia, ça c'est République Georgia. À la capitale Georgia, Tbilisi, pour une conférence. Et la conférence, c'était pour discuter whole issue environmental education, education sustainable development. Et 35 ans après, nous avons vu encore pour la noter qui commitment pour commencer à payer à respecter ces commitments qu'ils ont fait 35 ans passé. Et pour la nous aller. Meeting ça c'est organisé pour République Georgia et UNESCO et UNEP. En mettant ça nous discute que nous gardons tous ces commitments et ces recommandations qui étaient faites 35 ans passés. Et nous avons comment si ces pays, si nous avons respecté ces pays, si nous avons fait progrès en respecter ces pays, because nous tous nous d'accord avec nous d'accord que l'importance là que éducation là vient pour issues environment. Et nous avons dit qu'il pas tout bonheur dans l'âge monde, et pas tout vieux pour tout le monde, pour l'idée que nous pour protéger l'environnement et sustainable development. Because si nous pas garder, si nous pas protéger ça nous aujourd'hui, il n'y a pas de pièce bagaille pour le monde qui va venir, pour la génération qui va venir après nous.
En autre nouvelle, même parlement pour Guantans, Honorable Ian Douglas, qui a gardé du vent pour faire ville Guantans bien formidable. Honorable Douglas fait parole qui plusieurs projets qui a bâti à présent en parmi Hotel Resort and Spa à Cabrets, Révolution Kai en parmi d'autres, tout cas complémentaire fait ville bien formidable. Honorable Douglas aussi parlé contre projet pour faire Bifront là tourner au resort, ça c'est l'occasion pour touristes à visiter. Et aussi mentionné contre plan pour moun ça fait business, même comme business en ville ouzo, bagay comme passeport, licence, voiture et d'autres bagailles qui bien nécessaires en la vie moun. En la nouvelle, ministère santé, Honorable Julius Timothy, qui a créé assez officier santé pour travailler augmenter service en Dominique. Ministre Timothy qui a aussi fait parole, équipement et puis d'autres bâtiments, gouvernement qui bâti à Paris-Sam, ministre là qui a one créé assez monde pour prendre attention et puis la vie ailleurs.
Gouvernement actuellement nous avons mené bon nouveau toute qualité d'équipement. Nous avons bâti un nouveau hôpital, Princess Margaret. Nous supposons aussi bâtir un Marigot parce que pour l'aéroport là. Et puis, j'ai Guantans, nous avons upgrade ça. Mais le gouvernement, ça fait ça. Nous, ça prend plus docteurs, plus nurses. Mais c'est eux-mêmes. Si moi ni équipement et puis moi ni bâtiment là, et puis moi ni yo là, et puis yo pas qu'à faire travail là avec care. OK? Moi dis yo, c'est pas ni faire travail là. Ou supposé occuper moun. C'est ça, ou supposé occuper moun. Et puis si yo ka fait travail là, et puis yo ka occuper ces moun là, ça qui plus meilleur pour nous. OK? Nous que comme on dit, c'est pas ni là, mais nous que ni une meilleure qualité la vie.
Et puis finalement, boulangerie en Dominique qui a suivi WEG fait l'occasion chaîne opération à yo et puis ça fait label à ces produits à yo qui a commencé janvier l'année prochaine. Officier 20 boulangerie en pays là tapé trainement manière pour avancer opération à yo pour standard international. Ça fait label te tapé attention pendant ces officiers ça là te tapé trainement radio organisation Trinidad. Bureau of Standards Dominique te facilité traitement salam. En même temps aussi, officier boulangerie ici en Dominique déjà fait parole comment il a bien supporté l'initiative salam. Messieurs, mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non moins, c'est Macpherson St. Louis. Au revoir.
Up next is your tip of the day.
You're watching GIS.
Today we'll share with you a few tips on what you can do to care for your skin. First, it is important that you nourish your skin. Feed your skin with the vitamins and nutrients it needs by practicing healthy eating habits. Fill your diet with fruits and vegetables that are rich in minerals, vitamins, and omega oils. The best foods for healthy skin are fish, low-fat dairy products, deep green vegetables, and whole grains. Eating iron-rich foods such as apricots and sesame seeds will help improve your skin tone. And that's National Focus. As usual, we invite your suggestions and your comments. Please feel free to drop us an email at gis@dominica.gov.dm, or you can visit our website at news.gov.dm. You could also visit the GIS Dominica pages on both YouTube and Facebook. On behalf of the entire news production team, I'm your presenter, Tarnia Green. Thank you so much for watching.